draw a picture or kind words of encouragement or remind everybody that they are loved. I'm Beth. I'm in Nashville, Tennessee, and I am a long-term care nurse. There's 2 different floors at my facility. The first floor is rehab, so they're taking new admissions there. They treat things a little bit differently regards to they're wearing the 95 mask, the goggles, and everybody is on a 14-day isolation. On my floor, which is mostly long-term care, and we also have rehab overflow, like I said, on my floor, I'm not accepting any new admissions. So there's one less step of risk. We are doing the paper mask and the fabric mask. And that's just a precautionary thing. That's, coughing, sneezing, that kind of thing. People have to eat all their meals in their rooms. So they've taken away that social circle that they have with their friends there at the facility. Basically what they have is, any sort of like books or like puzzle games, stuff like that they already had in their rooms, or their TV. We do have iPads available so family can like FaceTime. I've seen people have signs and they come and like drive up to the windows and hold them up to their loved ones, which is really neat to see as well. My facility, they were allowing like cards, like paper products to come in, but they just have to sit for 3 days before they're allowed to go up to the floor. So you guys, I highly encourage, either cards, little notes. A lot of my residents do have dementia, and I know a lot of the family members are concerned in regards, since they can't see them or can't come visit them, that their parents or their grandparents, whoever the resident is, they might get confused or forget who they are. If you have pictures with them in it, I would say if you can send one in or make a copy and send one in. Again, encourage FaceTime, any sort of like face-to-face contact, so that way they could try to keep a face associated with a voice. Hey mom, it's me. Hey grandma, it's me. That kind of thing. I try to spend a few extra minutes with each of my patients if they're, wanting to chat. We just sit there and have fun and cut up for a few minutes, provide a laugh, share a smile, that kind of thing. And a lot of times they're like, I'm so glad you just talked to me. It does get heavy to carry around seeing that, my residents are starting to get depressed and they're lonely and isolated. And that also travels over from their mental health, goes into their physical health. So it's hard to see, some days you drive home and crying. But the coping mechanisms that have personally worked best for me, that's just something I do, is I usually just dance. Even if I'm in a patient's room and just being silly, if I can provide a smile to them, it's, I'm helping them, but I'm also helping myself. Knowing that the Grammys and Grampies aren't being forgotten about is so heartwarming. I've cried tears of sadness, but I've also cried tears of joy just by the outpouring of love in the community. I have somebody who's 99 years old, and I have somebody who's 100 years old. They've seen some pretty hard times as well, but you know what? They came through it and they're still very loving. They are optimistic. Every night I'm greeted with a smile from them. Even if they feel bad, if they're sick, they're still there and they still are happy. I do have hope. I am, witnessing the greater goods. People are, donating their time and their money. And I know that, so many people have lost their jobs and income, that money's not really in abundance right now. Everybody's kind of concerned about, their homes and how they're going to feed their children and all that other stuff. And to see people just donating all these resources is just amazing. It's so amazing. Be kind to each other. Please allow plenty of graces. It's okay to not feel okay right now. If you are not feeling okay, please reach out to somebody and wash your hands, please.